Before moving into the common mistakes people make with vitamin B12, it's important to understand why this nutrient becomes so much more important as we get older. Many people assume that if they are eating reasonably well, they must be getting all the vitamin B12 their body needs. Unfortunately, that's not always true, and this is one of the reasons so many older adults end up deficient without even realizing it. You see, vitamin B12 is essential for several functions that keep the body working properly. It helps produce healthy red blood cells, supports the nervous system, and plays a major role in maintaining memory, concentration, and energy levels. In many ways, it acts like a behind-the-scenes partner, quietly helping your body do countless jobs every single day. When levels begin to fall, the effects can show up in ways that people often blame on aging itself. One of the biggest reasons this happens is that the body changes with age. As we get older, the stomach naturally produces less acid. That may not sound like a big deal, but stomach acid is actually necessary to separate vitamin B12 from the protein found in foods like meat, fish, eggs, and dairy products. If that process becomes less efficient, less vitamin B12 is absorbed, even when a person is eating the right foods. That means someone can enjoy a healthy diet and still develop low B12 levels. I've seen many older adults who are surprised by this. They tell me, "I eat plenty of chicken and eggs. How could I possibly be low in vitamin B12?" The answer is that the problem isn't always what you're eating. Sometimes the issue is what your body is able to absorb. Certain medications can make the situation even more challenging. Millions of adults take acid-reducing medications for heartburn or reflux. Others take metformin to manage diabetes. These medications are extremely common, but over time, they may interfere with vitamin B12 absorption. Most people are never warned about this possibility, so they continue taking their medications for years without realizing that their vitamin B12 levels may slowly be declining. Digestive conditions can also increase the risk. Problems involving the stomach or intestines, such as chronic gastritis, Crohn's disease, or a history of gastrointestinal surgery, can affect how efficiently the body absorbs nutrients. Even people who have undergone weight loss surgery may face a greater risk of deficiency because of changes in the digestive system. Another factor that deserves attention is that vitamin B12 deficiency doesn't happen overnight. It develops gradually, sometimes over several years. Because of this slow progression, many people adapt to the changes without recognizing that something is wrong. They may notice they tire more easily, forget names more often, or feel less steady on their feet. Instead of considering a nutritional deficiency, they simply think, "Well, I guess that's just part of getting older." But growing older does not automatically mean accepting constant fatigue, brain fog, or declining energy. In some cases, these symptoms may be warning signs that the body is lacking an essential nutrient it desperately needs. This is why vitamin B12 deserves much more attention after the age of 60. It isn't simply another supplement sitting on a store shelf. It is a nutrient that helps support healthy nerves, cognitive function, blood cell production, and overall vitality. And because the body's ability to absorb it changes with age, understanding these changes becomes just as important as understanding how much vitamin B12 to take. The good news is that once you recognize why deficiency becomes more common in later life, you can take steps to address it before it begins to affect your quality of life. Knowledge is powerful, and in this case, understanding how aging changes vitamin B12 absorption may be one of the most important things you do for your long-term health. Because when it comes to vitamin B12, getting enough isn't just about what you eat, it's about what your body can actually use. Now, once you understand why vitamin B12 deficiency becomes more common with age, the next thing we need to talk about is recognizing the signs that something may already be wrong. This is where things become especially important, because many of the symptoms of low vitamin B12 are subtle at first. They often develop slowly, and because they overlap with common complaints associated with getting older, they're frequently ignored or dismissed. One of the earliest warning signs is persistent fatigue. I'm not talking about the kind of tiredness you feel after a busy day. I'm talking about waking up in the morning and still feeling exhausted. You may find yourself needing more naps than usual or feeling like you simply don't have the same stamina you once had. Many people assume this is just part of aging, but low vitamin B12 can interfere with the production of healthy red blood cells, which means your body's tissues may not receive the oxygen they need to function efficiently. Another symptom that often flies under the radar is brain fog. Maybe names don't come to you as quickly. Perhaps you walk into a room and forget why you went there. You might struggle to concentrate or feel like your thinking isn't as sharp as it used to be. These changes can be frustrating and even frightening. Some people immediately worry about dementia, while others simply accept memory lapses as inevitable. But vitamin B12 plays a critical role in maintaining healthy nerve cells and supporting brain function, and low levels can affect mental clarity in surprising ways. Mood changes are another commonly overlooked sign. A person who has always been cheerful may suddenly feel down, anxious, or irritable. Depression can have many causes, but vitamin B12 deficiency is one possibility that deserves attention. Because this vitamin is involved in the production of important brain chemicals, inadequate levels may contribute to emotional changes that are easy to mistake for stress or simply having a bad month. Then there are the symptoms involving the nerves. Tingling, numbness, or a pins and needles sensation in the hands or feet should never be ignored. Some people describe it as feeling like they're wearing invisible gloves or socks. Others notice burning sensations or unusual sensitivity. These symptoms occur because vitamin B12 is essential for protecting the covering around nerves. Without enough of it, the nerves themselves can begin to suffer. Balance problems are another warning sign that many people don't connect with a nutritional deficiency. Perhaps you feel less steady when walking. Maybe you've noticed yourself holding on to furniture or becoming more cautious on stairs. These changes are often blamed on aging muscles or arthritis, but vitamin B12 deficiency can affect the nerves responsible for coordination and balance. In some cases, this increases the risk of falls and injuries. Weakness is also common. Everyday activities that once felt easy may suddenly seem more demanding. Carrying groceries, climbing stairs, or taking a long walk might leave you feeling unusually drained. Once again, many older adults chalk this up to getting older, when in reality, their bodies may be signaling that something important is missing. The challenge is that vitamin B12 deficiency tends to develop gradually. Because the symptoms appear little by little, people adapt to them. They lower their expectations and convince themselves that feeling tired, forgetful, or unsteady is simply what happens after a certain age. But here's something everyone should know. While some changes are a natural part of aging, severe fatigue, worsening memory, numbness, and loss of balance should never be automatically dismissed. Your body has a remarkable way of sending signals when something isn't right, and paying attention to those signals can make a tremendous difference. Perhaps the most important reason to recognize these warning signs early is that some of the nerve damage caused by prolonged vitamin B12 deficiency may become permanent if left untreated. That's why waiting and hoping the symptoms will go away on their own is never the best strategy. Early detection and appropriate treatment can often reverse many of these problems and help preserve quality of life. So if you've been telling yourself, "I'm just getting older," it may be time to ask a different question. Could my body be trying to tell me something? Because the earlier you recognize the warning signs, the better your chances of protecting your energy, your memory, and your independence. By this point, you can probably see why recognizing vitamin B12 deficiency early is so important. But here's where many people run into trouble. Even after discovering that their levels are low, they often make mistakes that prevent them from getting the full benefit of treatment. And some of these mistakes are surprisingly common. One of the biggest misconceptions I hear is, "I'm taking a multivitamin, so I must be getting enough vitamin B12. Unfortunately, that isn't always true. While many multivitamins do contain B12, the amount may not be sufficient for someone who already has a deficiency or has difficulty absorbing the vitamin. In other words, simply seeing vitamin B12 listed on the label doesn't guarantee that your body is getting what it needs. Another common mistake is assuming that more is always better. Some people become concerned about their health and start taking very high doses without understanding why they're doing it. Others follow advice they found online without considering their own medical history or current medications. Vitamin B12 is generally considered safe, but taking random amounts without understanding your actual needs can create confusion and may distract from identifying the real cause of symptoms. Then there are people who choose supplements based solely on advertising. They see phrases like extra strength, premium formula, or maximum absorption and assume those products must be superior. But marketing language doesn't always reflect what your body truly needs. The best approach is not necessarily the most expensive bottle on the shelf. It's the one that matches your individual circumstances. Another mistake involves consistency. Many people begin taking vitamin B12 and expect immediate results. After a week or two, if they don't feel dramatically different, they stop taking it altogether. But vitamin B12 deficiency usually develops slowly, and restoring healthy levels also takes time. The body needs an opportunity to rebuild its stores and repair tissues that may have been affected. For some people, noticeable improvements occur within weeks, while for others, the process can take several months. I've also seen people stop their supplements as soon as they start feeling better. Their energy improves, the tingling sensations decrease, and they assume the problem has been permanently solved. But if the underlying issue affecting absorption hasn't changed, vitamin B12 levels may gradually decline again. In many cases, maintaining healthy levels requires long-term attention rather than a short-term fix. Another mistake that often goes unnoticed involves medications. Millions of older adults take drugs that may interfere with vitamin B12 absorption. Metformin, commonly prescribed for diabetes, is one example. Acid-reducing medications used for reflux and heartburn are another. Yet many people continue taking these medications for years without ever discussing vitamin B12 monitoring with their healthcare provider. They assume that because the medications are helping one problem, they couldn't possibly contribute to another. Some individuals also rely entirely on diet without realizing that absorption becomes less efficient with age. They may eat meat, eggs, dairy products, and other foods rich in vitamin B12, but because of changes in stomach acid production or digestive function, their bodies simply aren't extracting enough of the vitamin. In these situations, eating healthy is important, but diet alone may not be enough. Perhaps one of the most damaging mistakes of all is assuming that symptoms like fatigue, memory problems, or numbness are simply unavoidable consequences of growing older. People delay seeking help because they believe nothing can be done. They tell themselves, this is just part of aging. Meanwhile, vitamin B12 levels continue to decline, and nerve damage may slowly progress. The truth is, taking vitamin B12 correctly is about much more than swallowing a pill. It involves understanding your body's changing needs, recognizing factors that interfere with absorption, and staying consistent over time. It also means avoiding the temptation to self-diagnose based on internet trends or the experiences of friends and family, because what works perfectly for one person may not be the right approach for someone else. And that brings us to a very important question. If so many people are taking vitamin B12 incorrectly, which form of vitamin B12 is actually best for older adults? The answer may surprise you, because when it comes to vitamin B12, success isn't about taking more. It's about taking it wisely. After hearing about all the common mistakes people make with vitamin B12, one question naturally comes up. Which type of vitamin B12 should you actually be taking? Walk into any pharmacy or health food store, and you'll quickly discover that there are dozens of options. Tablets, capsules, gummies, sprays, sublingual drops, lozenges, and even injections all claim to be the best choice. It's no wonder so many older adults feel overwhelmed. The first thing I want you to know is that there isn't one perfect form that works for everyone. Despite what advertisements and social media influencers might suggest, the best vitamin B12 depends on your individual health needs, your ability to absorb nutrients, and whether you have an actual deficiency or are simply trying to maintain healthy levels. One of the most common forms available is cyanocobalamin. Some people immediately dismiss it because they hear that it's synthetic, but the truth is that cyanocobalamin has been studied extensively and has helped millions of people around the world. It is stable, affordable, and effective for many individuals. Once inside the body, it is converted into active forms that your cells can use. Then there is methylcobalamin, another form that receives a lot of attention. Because it is already one of the active forms used by the body, some people prefer it. You'll often see products marketed as being more natural or superior because they contain methylcobalamin. In reality, both cyanocobalamin and methylcobalamin can be effective. For most people, the difference is less important than maintaining adequate vitamin B12 levels consistently. Another area that creates confusion involves sublingual supplements. These are tablets or drops placed under the tongue, and many companies claim that they are absorbed directly into the bloodstream and therefore work better. While some people prefer them because they are easy to use, research suggests that oral tablets and sublingual forms are generally comparable in effectiveness for many individuals. In other words, placing a tablet under your tongue isn't necessarily a magic solution. Sprays and dissolvable lozenges have also become popular. Some older adults appreciate these options because they are convenient and easier to take than large pills. If swallowing tablets is difficult, these alternatives may be helpful. The important thing is choosing a form that you'll actually take regularly rather than purchasing something expensive that sits untouched in the medicine cabinet. Then we come to injections. Many people assume that vitamin B12 shots are automatically better than pills, but that's not always the case. Injections are often reserved for people with severe deficiencies, significant absorption problems, certain digestive disorders, or those who have undergone stomach or intestinal surgery. In these situations, bypassing the digestive system can be extremely beneficial. However, for many people, high-dose oral supplements may work very well without the need for injections. This is why blanket recommendations can be misleading. Your neighbor may swear by monthly injections, while your friend insists that methylcobalamin drops changed her life. But their experiences don't necessarily determine what's right for you. It's also important not to be fooled by flashy labels. Words like premium, advanced, or doctor recommended don't automatically mean a product is more effective. Sometimes you're simply paying more for marketing rather than additional benefits. Quality matters, of course, but so does understanding your own health situation. Another thing to remember is that vitamin B12 supplements are only one piece of the puzzle. If medications, digestive conditions, or age-related changes are interfering with absorption, choosing the right form becomes even more important. That's why blood tests and conversations with your healthcare provider can help guide the decision rather than relying solely on advertisements or internet trends. The goal isn't to find the fanciest supplement or the most expensive bottle on the shelf. The goal is to choose a form that is appropriate for your body, easy to maintain, and effective over the long term. Because ultimately, the best vitamin B12 is not the one with the most impressive label. It's the one that helps your body get the nourishment it truly needs. And once you've chosen the right form, the next question becomes just as important. Are you taking it in the right way? Because with vitamin B12, choosing wisely matters, but using it correctly is what makes the difference. Now that we've talked about the different forms of vitamin B12, let's focus on something that may be even more important: how to take it correctly. Because choosing the right supplement is only part of the equation. Even the best product won't do much good if it's not used consistently and in a way that supports your body's needs. One of the questions I hear most often is, when should I take vitamin B12? The good news is that there isn't one strict rule that works for everyone. Many people prefer taking it in the morning because vitamin B12 plays a role in energy production, and some individuals find that taking it later in the evening makes it harder to fall asleep. Others do perfectly well taking it with lunch or dinner. The key isn't finding the perfect hour on the clock. The key is establishing a routine that helps you remember to take it consistently. Consistency really matters. Vitamin B12 deficiency doesn't develop overnight, and restoring healthy levels isn't an overnight process either. Some people expect dramatic changes within a few days. When that doesn't happen, they become discouraged and stop taking their supplement. But rebuilding your body's vitamin B12 stores takes time. For some individuals, improvements in energy and concentration may appear relatively quickly, while nerve-related symptoms such as numbness or tingling may take much longer to improve. Another common question is whether vitamin B12 should be taken with food. In many cases, it can be taken either with meals or on an empty stomach. The most important factor is taking it in a way that you can stick with. If swallowing pills with breakfast helps you stay consistent, that's perfectly fine. If taking it after lunch works better, that's fine too. What matters most is making it a regular habit rather than an occasional one. Diet also deserves attention. Vitamin B12 is naturally found in foods such as fish, meat, poultry, eggs, milk, and dairy products. These foods can help maintain healthy levels and provide many additional nutrients that support overall health. However, as we've already discussed, simply eating foods rich in vitamin B12 doesn't guarantee that your body is absorbing enough. Age-related changes, digestive conditions, and certain medications can all interfere with absorption. That's why diet and supplementation often work best together rather than relying on one approach alone. Speaking of medications, this is another reason why regular monitoring is so important. People taking metformin for diabetes or acid-reducing medications for heartburn and reflux may have an increased risk of developing vitamin B12 deficiency over time. Yet many people continue these medications for years without ever having their vitamin B12 levels checked. A simple blood test can provide valuable information and help identify problems before symptoms become severe. And that brings me to something I believe every older adult should remember. Supplements should never replace regular medical care. Vitamin B12 is important, but it is not a magic cure for every symptom. Fatigue, memory changes, weakness, and numbness can have many different causes. That's why working with your healthcare provider and monitoring your levels periodically is such an important part of the process. It allows treatment to be tailored to your specific needs rather than relying on guesswork. Healthy lifestyle habits also play a supporting role. Staying physically active, getting adequate sleep, eating a balanced diet, managing stress, and keeping chronic conditions under control all contribute to better energy, improved brain function, and healthier nerves. Vitamin B12 works best when it's part of an overall commitment to taking care of your body rather than being viewed as a quick fix. Perhaps the most important lesson of all is that vitamin B12 is not something you should think about only when symptoms appear. Waiting until you're exhausted, forgetful, or struggling with balance problems means the deficiency may already have been present for quite some time. Prevention is always easier than correction. Taking vitamin B12 the right way doesn't require complicated routines or expensive products. It requires consistency, awareness, and a willingness to pay attention to what your body is telling you. Because when it comes to protecting your energy, your memory, and your independence, small habits practiced consistently often produce the biggest results. And sometimes, the smartest thing you can do for your future health is simply to stop assuming that good enough is good enough. As we come to the final part of this discussion, I want to focus on something that could make all the difference when it comes to protecting your health as you get older. While every older adult should pay attention to vitamin B12, some people need to be especially vigilant because their risk of deficiency is significantly higher. Understanding who falls into that category and knowing when it's time to seek medical advice can help prevent problems before they become much more serious. Let's begin with individuals living with diabetes. Millions of older adults take metformin every day, and for good reason. It's an effective medication that has helped countless people manage their blood sugar. But what many don't realize is that long-term use of metformin has been associated with reduced vitamin B12 absorption. This doesn't mean anyone should stop taking their medication. Far from it. It simply means that regular monitoring becomes increasingly important. If you've been taking metformin for years, discussing vitamin B12 testing with your healthcare provider may be a very wise decision. People who rely on acid-reducing medications also deserve special attention. Drugs commonly used for heartburn, acid reflux, and stomach ulcers can decrease stomach acid production. And as we've already talked about, stomach acid plays a critical role in helping the body release vitamin B12 from food. Over time, reduced stomach acid can contribute to declining B12 levels, even in people who eat a healthy diet. Another group at higher risk includes those who have digestive disorders. Conditions such as Crohn's disease, celiac disease, chronic gastritis, and certain autoimmune disorders can interfere with nutrient absorption. If the digestive system isn't functioning properly, the body may struggle to obtain enough vitamin B12, regardless of how carefully someone eats. Individuals who have undergone stomach or intestinal surgery also need to be particularly aware. Procedures performed for ulcers, weight loss, or other medical conditions can alter the body's ability to absorb nutrients. In some cases, lifelong vitamin B12 supplementation or periodic injections may be necessary to maintain healthy levels. Dietary choices can also play a role. Vitamin B12 is found naturally in animal products such as meat, poultry, fish, eggs, and dairy foods. Older adults who follow vegetarian or vegan diets may have a greater risk of deficiency if they are not consuming fortified foods or taking appropriate supplements. A plant-based diet can certainly be healthy, but vitamin B12 is one nutrient that requires careful planning. And then there are the symptoms that should never be ignored. Persistent fatigue, increasing forgetfulness, unexplained weakness, numbness, or tingling in the hands and feet, difficulty walking, poor balance, or frequent falls are all signs that deserve attention. These symptoms should not automatically be blamed on getting older. They are signals, and your body may be trying to tell you that something important needs to be addressed. One of the greatest mistakes people make is waiting too long. They tell themselves they'll mention it at the next appointment, or they assume things will improve on their own. Months turn into years, and during that time, a treatable deficiency may continue to affect the brain and nervous system. In some cases, prolonged vitamin B12 deficiency can lead to nerve damage that becomes difficult or even impossible to completely reverse. That's why blood tests are so valuable. They're simple, widely available, and can provide important information about what's happening inside the body. Sometimes the answer is vitamin B12 deficiency. Sometimes it's something entirely different. But either way, knowing is always better than guessing. I also want to emphasize something very important. Vitamin B12 supplements are not a substitute for medical care, and symptoms should never be self-diagnosed based solely on information from the internet. Every person is different. What works for one individual may not be appropriate for another. Personalized care and proper evaluation remain essential. The good news is that vitamin B12 deficiency is often treatable, and many people experience meaningful improvements once the problem is identified and managed correctly. Energy can improve, mental clarity can return, strength and confidence may increase. But the earlier the issue is recognized, the better the chances of preventing long-term complications. So if there's one message I hope you take away from this entire conversation, it's this. Don't assume that feeling tired, forgetful, or unsteady is simply the price of getting older. Your body deserves attention, and small changes today can have a tremendous impact on the years ahead. Because when it comes to vitamin B12, taking it isn't enough. Taking it the right way, at the right time, and for the right reasons can make all the difference.